Joining us now, Representative Greg Murphy. Dr. Murphy, also board-certified urological surgeon, as well as the co-chair of the House Republicans Dr. Caucus. Good to see you, sir.
Good evening.
Let's put it this way. Syphilis is unpleasant. We all know that. We don't need to. That's submitted and agreed upon. What I think is different here is that this is affecting a lot of people who don't have syphilis.
Right. You know, with the shortage of medication, it's led that this Penicillin G, which is the most common drug used for syphilis, is now not available to treat strep throat, some of the other diseases that need to be treated. Kids are not able to be treated. But now that we have this huge epidemic, it's literally sucking away all the other penicillin.
Look, like with monkeypox, it's pretty clear who the highest risk groups are for syphilis. And it's pretty easy to figure out how to prevent this. It's pretty easy to message on how to prevent this and to talk honestly about it. Why don't you think the FDA and CDC is doing it?
For social concerns. They don't want to be seen as targeting a group. You know, back in the HIV era, it was gay men that were primarily at target. But I think the CDC, and this happened all during the pandemic, became partly political in its nature rather than objective science. And they're afraid of, quote, hurting somebody's feelings and pointing out an at-risk population.
All right, and therefore saying, hey, for this at-risk population, this is what you need to do,
absolutely,
or not do. Where does this go? I think about the drug shortages: Adderall, Tamiflu, Albuterol, baby formula, amoxicillin, children's Tylenol and Motrin. Now add penicillin here. Yeah. At some point, this turns into a real problem.
It's a major problem, and some of this was highlighted during the pandemic with supply chain shortages. Other part have been quality issues, and the other part is bad regulation and laws by the government forcing our companies overseas. And so when only one company in this nation makes penicillin G, and there's been problems with quality, we're in a real hard spot.
Are we being fair to blame the FDA and the CDC for not being stronger about this?
No, I don't think it's fair. I think there's plenty of blame to go around. I think some of the regulatory environment, we've pushed our guys overseas. And plus, you know, this is a generic drug. You make pennies on the dollar. So there has to be some other type of incentive, some other drugs that are done to be able to produce this at the same time.
What takes this from being an uncomfortable situation, which it seems like to being a true crisis?
Well, if you look at the true crisis, first, syphilis in its first symptoms is absolutely asymptomatic. You don't know it. And then you get a rash, and you may not know that either until it's in its tertiary form is the first time you see symptoms. But the real sad thing, Leland, is kids are now being born with congenital syphilis. And they're born with so many different congenital anomalies, some of which, you know, they're going to have to live with their entire life if they're not stillborn. So it's a real major problem.
All right, but larger picture here from the cultural standpoint. Are we at the point now where the FDA and CDC need to ring the alarm bells louder and hurt some feelings and be direct in how they talk about this?
Absolutely. And there's a question of whether to declare it a public health emergency. Sadly enough, this became so political during the Biden administration, during the pandemic, of calling things emergencies. There's so much refractoriness seen on the American public about the government calling it an emergency. It truly is a health crisis now, not only in the United States, down in Houston and some of the other places, but really worldwide. And it's time to call it what it is. And tell what our target populations. And by the way, it affects more minority populations and those in poor environments than it does the other populations at large. And so this is, you need to go where the disease is and work hardest to prevent it.
And that's not happening.
No, it's absolutely not. And it's not done because on the basis of politics. We don't want to center out one particular group or not. And that's not the way we've always conducted science.
Yeah, no, and typically, as you point out, the poorest and the least fortunate among us are the ones who get hurt the worst in situations like use of access to medical care and everything else. It's sad. It really is. Good to see you, Doctor.
All right. Thank you.
As always. We appreciate it. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.